Welcome. My name is Matt Biasotti, and I'm a captain in clinical practices with Williamson County EMS. This presentation is about Narcan administration and recognition of signs and symptoms of an opiate overdose, which is commonly encountered in the pre-hospital setting. The intention of this presentation is to promote early intervention for those experiencing a life-threatening narcotic overdose. The learning objectives are recognition of signs and symptoms of an opiate overdose, awareness and competency with regard to scope of care and overdose treatment modalities, ability to assemble medication and titrate dose to desired effect, and a review of administration techniques including intramuscular and intranasal. Signs and symptoms of an opiate overdose. Patient may present unarousable or unresponsive to stimuli. Patient may have pinpoint constricted pupils, pale skin, blue lips or cyanosis, shallow breathing, respiratory depression, and may present with snoring type respirations. Signs and symptoms continued. Some of the key signs to note in this table are bradycardia, hypotension, sedation, and possibly slurred speech if patient is conscious. Data collected from a study by U.S. Department of Health and Human Services, along with Centers for Disease Control regarding unintentional overdose deaths in the state of Texas. In 8 years' time, deaths have more than doubled. Study continued. Overdoses are the third leading cause of injury-related death in Texas, behind only MBCs and suicide. Target population is middle-aged adults, ages 35 to 54. Another significant finding from the study was the impact on the youth ranging from ages 15 to 34. This demographic accounts for 31% of deaths recorded in the study. Have you ever seen anybody in this condition? Generic name is Naloxone hydrochloride, with the trade name more commonly known as Narcan. Narcan is typically packaged in a pre-filled syringe with a concentration of 2 milligrams in 2 milliliters of liquid. Commonly abused opiates include heroin, Oxycontin, Percocet, Vicodin, methadone, morphine, fentanyl, and codeine. Pay special attention to the transdermal medication patches like fentanyl. This form is commonly abused and a frequent cause of overdoses. Always check your patients for medication patches if suspecting an overdose. Opiates act as an agonist by binding themselves to mu receptors in the central nervous system, causing their effects. Narcan acts as an opiate antagonist. This essentially means it binds to the mu sites in the central nervous system and blocks the access to the opiate receptor, causing the reversal of symptoms. Think of it as a lock and key. Narcan removes the narcotic key and inserts itself to block the keyhole, causing the reversal of symptoms associated with narcotic overdose. Let's take a look at our scope of care. Narcan is found in sections 3140 and 4607. Key point to note is to titrate to effective ventilations. The intention is to give the appropriate amount to reverse respiratory depression and not cause harm. Example would be administering the full 2 milligrams initially and causing our patients to become agitated and combative. The rapid reversal of the effects of opiates can cause patients to become highly agitated or even sick, and nobody likes vomit. Six rights of medication administration. Right person or patient, right drug, right dose, right time, right route, and right documentation. Principles of medication administration include proper body substance isolation, medical asepsis, trying to keep the site and the syringe as clean as possible, and proper disposal of sharps after administration. Routes of administration that we're going to look at today are the intranasal and the intramuscular route. Medication delivery. Assemble the prefilled syringe with the needle and inspect the needle, the bevel of the needle, for any defects. Cleanse the site with an alcohol prep, starting with small circles working outward. Remember not to touch the site after wiping the site with an alcohol prep. Commonly utilized sites for IM administration include the upper arm, known as the deltoid, the lateral thigh, known as the ventrogluteal site. After you select the site and properly prep, you should hold the skin tight or pinch to tent and insert the needle at a 90-degree angle in one rapid motion to ensure the appropriate depth is achieved. Keep in mind this may be to the hub on larger individuals with more adipose tissue. Aspirate by pulling back on the plunger to check for blood return. If no blood return, administer the medication. If blood return, remove and select another site as you have possibly hit a blood vessel. Intranasal administration. Assemble the prefilled syringe. Attach the nasal atomizer to the end. Insert soft cone into nair and push the plunger. Try to limit each administration to 1 milliliter at a time per nair. Once completed, properly dispose of any sharps that you may have used in the proper container.